So there is returning interest in axillary dissection as a staging procedure in patients with positive nodes to determine the exact tumor volume in the axilla and applicability of systemic therapy protocols or molecular tests. So sometimes medical oncologists ask us surgeons to go back and perform dissection so they better know how to indicate systemic treatment. So in the first 500 randomized patients have had axillary dissection, the other did not have axillary dissection. We had massive tumor load, 60% had 4 or more positive nodes in the dissection group, and in the radiation group with no dissection, patients were heavily understaged. And despite all this, there was absolutely no difference in rate or type of systemic therapy in the adjuvant and neoadjuvant setting, meaning that in our hands, at our sites, medical oncologists did not use this additional information on the total number of positive nodes determined by axillary dissection.